Thank you, Jeff. You know, it said 1 in 8 women will be diagnosed with breast cancer in their lifetime, but thanks to awareness and technological advances, death rates from breast cancer are declining and have been since 1990.
Now, the first step and most common form of treatment for breast cancer is surgery, and while the days of radical mastectomies are not gone, time has given patients more options when deciding to move forward with treatment. And here to explain some of those options for breast conservation is board-certified surgeon Dr. Garrett Peel. Good morning. Thanks so much for being here this morning.
Good morning.
Yeah, this is always a rough time for ladies and men to go through who might suffer from breast cancer, but to be able to conserve the breast now, so many options is just, it's got to put a little bit of ease back into some of it.
Sure. The key, though, to remember is the reason why we can conserve the breast tissue is because we have caught most of these cancers very early through screening mammograms.
Yeah, and if it's not
mammography saves lives. Get your mammogram. We've talked about that all month now.
Sure.
And so if we can find a small stage 1, usually breast cancer, we can what we offer breast conservation treatment, where it's essentially a surgery or a partial mastectomy or lumpectomy to remove the breast cancer, but then also use sentinel node technology to check the lymph node and stage the patient to determine if the patient may or may not need chemotherapy.
Yeah.
The key, though, is to remember, if you have a lumpectomy or partial mastectomy, you have to have follow-up treatment. So usually if the cancer is greater than 1 centimeter, which is about half an inch, patients usually need chemotherapy for that. Doesn't matter what age they are.
Yeah.
That's the cutoff usually. And then radiation therapy. Radiation therapy essentially treats the breast tissue around where we remove the cancer so that it will decrease the risk of that cancer coming back or recurring in the breast.
What is what are the rates? I mean, typically, because that would be my biggest fear, as I may say, okay, just do a total mastectomy because I don't want the chance that it may come back. Does it happen very often?
A recurrence rate without radiation is upwards to 60 to 70%. Because as a breast surgeon, you know, I can get that breast cancer out and I can get everything I can see and feel, but sometimes there's microscopic disease elsewhere and you can't see that on a mammogram or an ultrasound or in the operating room. And so radiation, we know, given to the breast, whether it be from the outside or the most recent innovation from the inside out, which decreases the treatment time from about 8 weeks to only 5 days, decreases the recurrence of less than usually 10 to 15%.
And you wouldn't have to have that radiation, though, if you did a mastectomy, but that's a major
Correct,
deal,
but some women who have a mastectomy actually do need radiation if their lymph nodes are involved or if the tumor was a certain size and close to the chest wall. But the partial breast radiation innovation is something that we're particularly proud of, where we can offer women an alternative, where instead of having to go to the radiation oncologist every single day for 8 weeks, usually, the woman is left with the opportunity to go for 5 days, twice a day, where we basically put a small catheter into the breast and the radiation oncologist treats the breast tissue from the inside out, and that's called partial breast radiation or HDR, high dose radiation. We find that the data are very similar in recurrence rates and effectiveness and safety, so it's a very exciting thing. And a lot of my patients are working women and mothers and are even in their 40s and younger 50s, and so this really gives them a lot of freedom to have their breast conservation. We can stage them with sentinel node biopsy and then get them to treatment very quickly so they can return to their lives as a survivor.
That's amazing. 5 days.
Yeah, it's incredible. And I know that it's no longer a death sentence. What are the survival rates now for women with breast cancer?
We've got particularly good at saving lives, not only saving breast and saving time.
Sure.
And the survival rates exceed, 5-year survival rates exceed 95% in stage 1 breast cancers.
In stage 1.
And why? Because we find these cancers early.
Detection,
However, we are also seeing that even stage 2 and 3 breast cancer patients and even stage 4 breast cancer patients are living longer now more than ever.
Right. Yeah, that's amazing. You know, we get so much information, we learn so much every October, but as we've said all month long, don't limit your knowledge, don't limit your testing, any of that to October.
Right.
This is a year-round thing that you should
get your mammogram every single year, age 40 or more, 35 or greater if you have a family history of breast cancer. Pick a day, pick your birthday day, do a self-breast exam every single month. Remind someone to do that as well. We call them the buddy system. And if you feel something strange, if you feel uncomfortable, if you have drainage, if you have skin changes, seek a doctor quickly.
Yeah,
Immediately.
absolutely. Early detection, that is the number one thing.
Saves lives.
It
It's
certainly does.
been a good month talking about this.
Certainly
Hopefully get a
has.
lot of people to get those exams done. Thanks so much, Doctor. for
Thank you
coming
so
on.
much.
Coming up, Jeff Gerber will have another check of our forecast.
And it's now 7:47.